There are a lot of theories about it, but not one study or one practitioner will tell you that they know with certainty what causes migraines. But we know with certainty that inflammation within the temporomandibular joint will cause headaches to go away, bad headaches, because when you decrease the inflammation in the joint, the headaches decrease. And that has been shown by many studies, including the study that we've just completed based on my 3,000 cases in an independent study through Middle Tennessee State University. So I want to go forward from this point, not only in this edition of the podcast, but all editions to come, from the point of view that we are dealing, and we want to deal with science. Science is the gold standard. The scientific method is the gold standard. And science is nothing more than the study of cause and effect. And so we can know the effects. It is important for us to know the effects of TMD because those are called symptoms. An effect of TMD, which is inflammatory changes within the joint, temporomandibular joint, will directly cause all of those symptoms. And I've discussed it in detail in prior episodes of why that is. How can inflammation within the temporomandibular joint itself create directly all of those different symptoms, which is confusing to the patients and confusing to almost all doctors, especially physicians, and almost all of the dentists, but physicians for sure, because they have actually, believe it or not, a limited scope on anything having to do with the temporomandibular joint. It doesn't even come in to their wheelhouse. They don't even think about the temporomandibular joint because to them, the temporomandibular joint is part of dentistry. And how do I know that? Because I have heard hundreds of times when patients come in and they say, I have seen my PCP and I believe, or he believes, or I believe, or I have been told that I have TMD. The next word out of the physician's mouth is, well, you need to go see your dentist.